Society, the Academic Honor Society in Pharmacy. My name is Kathy Worrell, and I serve as the faculty advisor for the Alpha Iota chapter here at MUSC. We are trying to help some folks get online to be able to watch the ceremony tonight. So if we do have anybody in the Zoom yet, we just wanted to welcome you and thank you for joining us tonight. The Rho Chi Society seeks to advance pharmacy through intellectual leadership. As the Academic Honor Society in Pharmacy, the Rho Chi Society encourages and recognizes intellectual achievement, stimulates critical inquiry to advance pharmacy, contributes to the development of intellectual leaders, promotes the highest ethical standards, and fosters collaboration. Membership in the Rho Chi Society is a privilege accorded to the very few who distinguish themselves by their academic and professional achievements and who aspire to the mission and vision of the society. Members may be elected as professional or graduate students in pharmacy, as members of faculties of schools and colleges of pharmacy, as alumni who distinguish themselves in the profession, or as honorary members by special action of the National Executive Council. Before we begin our ceremony, just a couple of housekeeping announcements for the folks who may be visiting us for the first time. Restrooms are located directly outside of this room to the right, in between this building and the building next door to us. We will be serving dinner just outside the auditorium. I'm sure you saw all that as you were walking in, and that will be immediately following the ceremony. At this time, please turn your cell phones and pagers to silent or vibrate as we start our ceremony. Initiates. When I call your name, please come forward to receive your Rho Chi pin and certificate. Please remain on stage until the conclusion of the initiation ceremony. We'll begin with our collegiate initiates. Cassidy Bates. Samantha Bryce. Ashton Coker. Elizabeth Cox. Taylor Fuox. Mahilani Kankoa. Madison Lechner. Brenda Maldonado Llanes, excuse me. Jacob Pritchard. Caitlin Price. Madison Price. Jennifer Smith. Julia Smoke. Caitlin Wallace. Charlene Watson. And Jessica Williams. And everybody on stage may need to start snuggling up a little bit because we've got quite a few more to get up here. All right, for the first time this year, I think since we had a post-baccalaureate PharmD program, we are recognizing some post-baccalaureate initiates. Please come forward when I call your name. Ahmed Alanazi. Shahad Algandi. And Shama Al-Zaidi. We have one graduate student who was scheduled to be initiated this evening, but she is in a conference in California presenting her research. So we will be hopefully inducting her at our next chapter meeting. So finally, we are inducting 2 faculty initiates this evening. The first is Dr. Peter Berger. And Dr. Danielle Townsend. President Sedgwick and members of Rho Chi, the persons before you have proved themselves worthy of membership in the Rho Chi Society. I present them at this time to be initiated.
Candidates of Rho Chi, by your academic record and personal qualities, you have merited a place among us. As members, it will be entrusted to your ability and conscience to nurture the ideals and interests of our chapter and our national fellowship. Listen now to a resume of Rho Chi's history, for it reveals the intense feeling and high purpose of men and women who brought into being an honorary society in pharmacy.
There have been Greek-letter fraternal societies in pharmacy long before the establishment of an honor society in pharmacy. For years, plans have existed for a special kind of fraternal group whose main purpose would be to stimulate scholarship and research, and whose membership would reflect the intellectual and human qualities necessary to breathe life into society's aims. The efforts of many bore fruit on May 19, 1922, when the first chapter of Rho Chi, initiated at the University of Michigan, was given national recognition. Sanctioned by the organization now called the American Association of Colleges of Pharmacy, the society grew. Our own Alpha Iota chapter was the 33rd to be organized and received approval from all the other member chapters. In high standards maintained by Rho Chi have resulted in the general recognition of membership as a distinction analogous to the election to great honor societies in other fields of scholarship.
It is into this tradition and respective fellowship that we invite you. We have chosen with care, mindful of the responsibilities that will be yours, for soon in your hands will rest the welfare of this Alpha Iota chapter, which others have labored to establish and maintain.
Rho Chi offers you an opportunity and stimulus for greater service. Our membership confers distinction, but keep this well in mind. No distinction, no honor, no privilege comes to anyone without added responsibilities. Listen well to our mission and vision in order that you may better understand the high honor of membership and what is expected of a Rho Chi member.
As the academic honor society in pharmacy, the Rho Chi Society encourages and recognizes excellence in intellectual achievement, stimulates critical inquiry to advance pharmacy, contributes to the development of intellectual leaders, promotes the highest ethical standards, and fosters collaboration. The Rho Chi Society seeks to advance pharmacy through sustained intellectual leader. Your action should reflect pharmacy at its best and the high standards symbolized by Rho Chi's insignia.
The emblem of this society is the octagonal key bearing the Greek letters Rho Chi, combined to form that ancient and common symbol in pharmacy representing the use of medication in healthcare. The 8 sides of the key have evolved to represent the elements that form the foundation of our profession: chemistry, biology, physiology, pharmaceutics, pharmacology, the biomedical, social, administrative, and clinical sciences. Our colors are purple and white, the royal purple of the highest intellectual efforts, and the white of truth and loyalty. Our purposes lie in the unswerving aim of our members to adhere to and promote the highest ideals in pharmacy, both scientific and cultural.
And now, with full knowledge of the purpose and aims of Rho Chi, are you willing to join the society, to support the society, and to work with the society to the best of your ability? If so, signify by saying, "I am." As officers of the Rho Chi Society, we warmly welcome you into our fellowship. Everyone can now have a seat, and we will have our keynote speaker come join us. It is now my pleasure to introduce this afternoon's ROCI lecturer, Dr. Mark Lapoint. Dr. Mark Lapoint is a professor in the Department of Clinical Pharmacy and Outcome Sciences here at the College of Pharmacy. After graduating with a Bachelor of Science in Pharmacy from the Université Laval in Quebec in 1993, Dr. Lapoint earned his Doctor of Pharmacy degree at MUSC in 1995 and stayed on at the university to complete a specialty pharmacy practice residency in critical care. The neurocritical care and stroke expert joined MUSC as a clinical pharmacy specialist, serving in neuroscience specialties with a joint appointment in the College of Medicine. He served as director of MUSC Spasticity Clinic for many years and then evolved as director of acute care stroke research and the translational research unit in the Department of Neurosciences. An accomplished researcher, compassionate advocate for the underserved patients, and dedicated teacher, he has conducted several significant clinical trials to advance the treatment of patients with stroke, traumatic brain injury, and other critical illnesses as a principal investigator. Dr. Lapoint's outstanding work in and out of the classroom has garnered affection and respect from students, earning multiple Teachers of the Year honors. So please welcome me in joining Dr. Mark Lapoint to the podium.
I would prefer with this one. Can you, Dr. Shirley, can you hear me well? Very good. Well, good evening, everyone. What an honor to be, what a distinct pleasure to be with you tonight, especially for a ROCI member who became ROCI through the back door because I was not as smart as you. All right, so I remember receiving my PIN a few years ago and asking myself, I don't belong to this group, but you guys made me belong, so thank you. So thank you very much for the invitation. We have some parents tonight, so thank you for joining us. Congratulations to the P1 to P4 students, my colleague, Dr. Berg and Dr. Thompson for joining a ROCI. When Maddie called me to do the presentation, I said, I need some guidance. And she said, I was specifically asked to share my career and journey and discuss my time as a clinician in neurocritical care, director of clinical trials, and also my role or my transition to academia. And I have to be honest with you tonight. I wish I could tell you that everything was planned, but it wasn't. My career path is the result of serendipity with a power of 100% at a p-value of 0.99. So you know what that means. I rolled the dice and I'm here today. Even my career in pharmacy in college in Canada is pure random. I'd never spoken to a pharmacist and I applied to pharmacy school because I heard somebody who was applying to be in pharmacy and I put pharmacy as a backup plan. I wanted to become a food engineer and I got chosen and that other gentleman did not. And I ended up at Laval University. Again, pure serendipity. In the past, I've given presentation to students about road to character, how to be successful in life, work ethics, professionalism, and also the 4 agreements in life that helps you become a fulfilled individual. But you guys are already successful and have demonstrated your solid character and work ethics. Otherwise, you would not be here tonight. So I debated about what could I uniquely offer to this group, because I did not want it to be another speech. And I was certainly not going to talk about the importance of intellectual development and academic achievement. Sorry, Maddie. You guys deserve better than this. You know this better than I do. Instead, I wanted to talk to you about being street smart. And last night, I called a very accomplished clinician, Dr. Mark Corvino, who has a successful career as a clinical pharmacist. He's got a podcast that This year will be downloaded to, actually, he's going to achieve 1 million download this year. He's got 35,000 followers, and he's in so many different countries. And I called Mike last night because I vividly remember that rotation. I had 2 Rokai students and I had Mike. Mike and I asked him permission to tell the story. Mike was in pharmacy school, but he was also professional martial art. He was showing up in class pretty messed up. And during the rotations, we had these topic conversations, and Mike was always saying, oh, I cannot answer this. I'm a non-Rokai. I'm going to let the Rokai. That was kind of the joke at the end. I said, Mike, you're very smart. You're street smart. You were octagon smart because you could have died in the octagon. I said, you can make it. And Mike has made it. And what I've noticed over the years that even though you're equipped with the knowledge, you also have to be emotionally intelligent and street smart on rotation. Because frankly, it's easy to be street smart when we are among pharmacists because we all train the same way. You can finish my sentences, I can finish yours. But when you work with physicians, when you work with nurse practitioners, nurses, PA, and other healthcare workers, they have a different background. So what's important to you might not be to them and vice versa. So this is what I would like to share with you today, because when I started to do these clinical trials, I needed the physicians, I needed the PA, the nurses, and everybody in the ICU to buy into these projects. And I think that if I had not been street smart, I don't think I would be here today. So let me say first that as a pharmacy student in Canada who was involved in everything, even becoming president of the Canadian Association of Pharmacy Students. And the funny story about this is where I met young Dr. Worrell, Tom and Kathy. I met them in the meeting in Dallas. They had never spoken to a Canadian before with an accent, so they were like so impressed. And that was my first trip to the US. I've never seen my face the size of 3-story high at a presentation. So I still remember the first time I met Kathy and Tom. Unbeknownst to me that we would become colleagues later, and I helped recruit Dr. Worrell in the ICU. So back in the days, my plan was to buy a pharmacy. My mentor was a successful pharmacist, a politician who also became a lawyer who offered me his pharmacy. And that was my path until I met the first cohort of Canadian PharmDs who had returned from the US. And that changed my mind. I felt that a void inside me that I was ill-equipped with knowledge and I needed more clinical experience. And I boarded a Greyhound bus in Montreal, came here 36 hours later for an interview. And I was the lucky one to be chosen. So back in the days, the PharmD program at MUSC, we had a class of 20 students or so. It was a post-grad, so you needed to do a baccalaureate first. And they used to take 1 or 2 Canadians every year in the class. So I was very fortunate to be selected. So I moved to Charleston, was part of the class of 1995. Then I was offered a residency training in critical care, as I'm the type of person who likes to live on the edge. I'm the kind of guy who hates to work 8 to 5. I would rather come here in the middle of the night and enroll somebody in a traumatic brain injury and spend the night with the family and draw CSF and blood and spin it in my lab and spend 2 or 3 days here and sleeping in the call room. This is where I thrive. Now I'm too old to do these things, but this is what drove me at MUSC. I developed some very unique career. So my plan changed, came here, and I got to meet someone that changed my career when they offered me a residency in critical care. The person is Dr. Mike O'Neill. Mike O'Neill was a fantastic clinician. Everybody respected him. As soon as he walked in the ICU, everybody paid attention. He was running the codes. Everybody swear by him. And one day he called me. He said, Mark, something's got to change. I expect more from you. And this is what I want to share with you today. He said, Mark, if you want to be successful, you have to be visible, available, and recognizable by all in the ICU. You need to get to know all the nurses, the docs, the residents, talk to them, find out about them. They need to become your colleagues. It's one thing to know about drugs, but there's more to that. Then he said you have to be dependable so that you can earn their trust. And you have to be resourceful and embrace the challenges of the moment. So if you're not in the ICU, they cannot call you. You have to be there where the action is. Don't hide in your office. And here we're talking back in the 90s, and the dean can probably speak to us, and Tom and Kathy, is that we didn't have these smartphones. So the PharmDs, we were equipped with our peripheral brains. Our pockets were filled with these little books that we had copied in the library, so that if we needed a dosing conversion of opioids, we were the only one who had the knowledge. But things have changed now, right? Even so, a high school kid can pull their phone and find the answer. So we have to become smart in a different way as a pharmacist now. So after my residency, I turned down a research fellowship in Canada. I thought I was too research-like and I was too focused in neuroscience. But unbeknownst to me at the time is that I would become a clinical pharmacist in neurosurgery and do research in neurosurgery. So you never know where opportunities are going to take you. But I took the job at MUSC, and I still remember attending my first faculty meeting next to Dr. White for the P4. Remember Dr. White? Dr. Nappy, and facing Philip Hall, our dean, with Dr. Chessman. At that time, I thought I had made it. My salary increased from $20,000 a year to $52,000 a year. I made it. No, I did not, because these faculty prompted me to push forward. So next part of this presentation is, this is something that I vividly remember. And I'm going to take you back to 1998. You guys were not born in 1998. Okay. The parents do. So my academic career skyrocketed in 1998 without knowing this was happening to me. We, at the time, the Department of Neurosurgery had hired a new chair. And this chair, his vision was to change the department to go from eminence-based medicine to evidence-based medicine. Because in neurosurgery, we're probably the last one to go and move towards evidence-based medicine. And the surgeon I work with, they all train at McGill University in Montreal. That used to be the epicenter of neuroscience in the world in the 50s and 60s because of Dr. Penfield. He's the guy who mapped the human brain. He's the guy who determined that if you poke over here, this is what's happening to your finger. That happened in the 50s and the 60s because he was resecting tumors in the brain of French Canadians. And this is how they started to map, and you could see pictures that he was kind of putting flags in the brain. Okay, this is the toe, this is the arm, this is the fingers, and this is the emotion and the vision. So he's the guy who came up with that. So maybe that's why I'm still in Charleston 30 years later. So thanks to the brain of French Canadian, now we know what the brain does, right? So let me try to translate to you in a short story what it's like to be visible, dependable, and resourceful. And that to me, that happened on a Sunday morning on round when the new chair of neurosurgery were running on a lady with sickle cell disease, and we're trying to drain the blood out of her ventricles, but it kept coagulating, and she was about ready to herniate. And Dr. Haynes, the new chair, who was so evidence-based medicine, looked at me and said, "Mark, can you look up if we can give TPA in her brain to remove the blood?" And I'm thinking, have you lost your mind? This is absolutely contraindicated. But when the department chair asks you to look something up on Sunday morning, you go camp at the library. You don't go on your laptop, you just go at the library and find the books that you need. And we find out that that therapy had been tried in animals and phase 1 human trials in Europe. So we did treat that lady with TPA, like for the parents, kind of a clot buster that we gave her directly into her brain. But while I was reading the articles, I could read between the lines that there was some folks at Johns Hopkins University who were gearing up to do a true phase 1 human trial. So I called Johns Hopkins, left a voicemail, tried to cover the French Canadian accent, tried to sound like a neurosurgeon. And one day, while I was driving on Sam Rittenberg Boulevard, in front of the Blockbuster video, I got a page. My page is ringing. Area code 410. I said, I think it's Baltimore. Pulled the car, and armed and equipped with my calling card, I called back from the telephone booth, and I convinced them that to let us join their team. And the end result of that call is that after that, we got involved in 20 clinical trials over the course of 15 years. That was the first time ever that MUSC was enrolled in a stroke trial. We became the #1 enroller in the world for that trial, and we became the #1 enroller in other trials as well. So much so that some people in Europe came to visit us because we had enrolled more patients in Charleston than the entire country of India. And we kind of looked suspicious on the record. So this is what visible, dependable, and resourceful is. So whenever you have a chance to get involved, take it to the next level, jump on the occasion, because you don't know where that's going to lead you to. So somewhat relevant to that story, and at the same time, I want to thank you for having me here tonight, is that I recently took some students in Atlanta at a professional meeting. And we're talking about residency, because apparently the P4 are very stress about the residents. If they don't match, their world is going to crumble. So I was trying to motivate them and telling them that's not the end of the world. And I was telling them that my favorite question during an interview to a candidate was, tell me a story where you went home that night and you felt that you had made a difference in somebody's life. Tell me about a compassionate story. And sometime during these interviews, I had these candidates like blossoming. They were emotional. They told me what they had done that day, and I could live it. Those are the students I wanted to work with, and maybe work for them to become residents. And sometimes I had students who were like blank. Nothing came out, even if their GPA was 4.0. Needless to say, those were discarded. So telling my story, running my mouth with these students, and then a ROCI member had to ruin it for me. He said, Dr. Lapoint, what are you the most proud of? Your proudest moment in your career? And then I was not expecting that question. I've asked that question 100 times, but nobody had ever asked me that. And I blanked for 10 seconds. And it felt like 10 minutes. I said, is this really happening to me right now? I'm failing my interview in front of my own students. And so I kind of snapped out of it, had to bounce back. And without hesitation, I said, what I'm the most proud of is that I have brought all these trials at MUSC. In 15 years, I have never lost a study subject to a clinical trial. Because often you put everything, all your effort to enroll them, but you have to follow these patients for 3, 6, 9 months, 12 months, up to 2 years. And I've never lost anyone. I ended up in nursing homes in the middle of nowhere. I ended up visiting people in their living room, interviewing them on their porch. And a lot of these study subjects are still calling me today. I have a gentleman from New Orleans. He still calls me once or twice a year. Even though the study was finished, terminated 15 years ago, I am the go-to guy. When he's got a drug question, he calls me. So he helped the science. I'm trying to return the favor. And I think that people stayed with our research because we were visible, dependable, and resourceful to them. I think it's very important. It's just too easy to enroll a patient and walk away. Okay, I think that the family and the study subjects deserve better, especially if your loved one was in a motorcycle crash, comatose, or grandma with a severe hemorrhagic stroke or spinal cord injury and you're paralyzed. You need to get vested with the family. You have to do the right thing. Then I said, I'm kind of proud that I brought all these stroke trials at MUSC and that we received national recognition and some revenues as well. But lastly, I said, you know what, guys, I'm also proud of the fact that I have received a few recognition from students. And over the years, these recognitions means so much. I know that many of you want to go into academia. And these are the moments tonight. Because when you have an honor like this to speak to you, you end up validating that my thoughts, my words, my actions, my habits, my character, my crazy stories in class meant something to you. So for the P1 and the P2, brace for the P3 years, because you're going to hear a lot of these stories from the ICU. So take a moment to thank you guys for inviting me. It's one of these moments that you cherish and you just don't forget them. You know, in life, I hope that tonight I was able to convince you that you have to become street smart. You guys are already so smart and so much involved. But whenever you're going to start doing your first rotations, now you have to become smart with other healthcare providers, and that's going to be a game changer for you. So don't be on the back row, get involved, and good things will happen to you. So I hope I was able to convince you that you have to be visible, dependable, and resourceful. And you know, in life, the way you do anything is often the way you do everything. So if you carry that with you, even during your summer rotation, I'm sure that's going to serve you well. So you guys are already smart. COP, the College of Pharmacy, values your leadership. You guys are helping a lot of our students who might be struggling at times. So we thank you for that. But now is the time for you guys to become street smart. Challenge yourself, and whenever you have an opportunity to take a challenge to the next level, go for it. You'll never have any regrets, and God knows where that's gonna lead you for your future career. All right, so that's all I could come up with. Sorry, I did not talk about the value of leadership and intelligence. You guys know this already. You got that from your parents and for some of my colleagues as well. So thank you, Maddie, for inviting me.
Thank you very much, Dr. Lapoint, for those exciting words here. We will, if you'll please accept this as a token of our appreciation for being here tonight. If you don't like it, you know where you can find me tomorrow morning in lab. That's right, exactly. I'm glad that the parents also got to learn what TPA is. It's a glimpse into what we do every day. And so at this time now, I would like to invite Dr. Worrell and Dr. Hall up to the podium for the award ceremony.
All right, thank you, Maddie. And Mark, as always, we enjoy your stories. So thank you for being here tonight. All right, we are going to begin our recognitions by calling up the 2021-22 ROCI Executive Board. So if you guys will come up when I call your name, and stay on stage until everybody's up here. So President Maddie Sedra, Vice President Rosa Lee, Secretary Michaela Yaskolski, our Treasurer Nicole Arroyo, and our Historian Cameron Brakefield. And I'd like these guys to hang out up here while we talk a little bit about their accomplishments this year, because they have done a lot and I'm very proud of them. They have been a pleasure to work with. So just to kind of recap the year a little bit, which they'll be doing in our annual report very soon. We always start the fall semester with a recognition ceremony for our second year students to recognize their academic achievement through the first year of the program, and to give them some encouragement as they start the DPT series, which is drug disease processes and therapeutics. And for those of you who don't know that course, it's a tough course, and the first semester of it is tough. So we always like to give them some good words of encouragement before they head into that. They also helped out a lot just with some supportive activities with inviting Dr. Alice Libet from CAPS, which is Counseling and Psychological Services, to come and speak to our students about wellness, just to kind of keep them motivated. And we also worked with the CAE, which is the Center for Academic Excellence, to have them come and work with the students on some study skills, I think through all 3 years of the curriculum this fall. They also tried to help out the P1s by developing a Quizlet for the top 200 drugs that they need to learn. So I think they really appreciated that, and I plan to share that with our incoming students so they can get a head start on that this summer. Currently, we are hosting a book drive right now, and there's actually some information out on the tables when you guys eat dinner tonight if you want to help out with the book drive. It's for a philanthropy called Reading Partners, which is a children's literacy organization. So I encourage you to take a look at that during dinner. There's QR codes that you can just scan on your phone. You can go on there and order some books. And we just wanted to give a special shout out to Emma Bredberg, who's been leading up that effort. So Emma, thank you. As a follow-up to the naloxone training that we got a grant for last year, our students have been working with one of the other student organizations, the Academy of Student Pharmacists, to create a naloxone patient information sheet. And that will be used in the MUSC outpatient pharmacies. And I think they're wrapping up the final copy of that to be distributed. And again, we'd like to recognize the 2 students who've kind of headed that up, which is Melissa Ferris and Jenny Smith, for their efforts with that. We did submit another chapter project proposal this year, and I think Maddie did the lion's share of that work, but I think everybody was probably involved that's up here on the stage. And that was focused on continuous glucose monitoring device education. Although we weren't selected for funding this go round, we will resubmit for the next cycle, but it was a very well thought out proposal, and I'm really proud of you guys for putting that together. We had quite a few folks come and talk at our meetings to kind of educate ROCI members and non-members about some careers in pharmacy, and that included Dr. Jimmy Pruitt, one of our faves, Dr. Shelby Colo, Dr. Amelia Furbish, and Dr. Taylor Morissette. You guys may remember from, if you were here last year, that we nominated Dr. Jean Nappy for the ROCI Lecture Award, which is a national award. We found out last May, so after you guys had already left, that she was selected for that award, and she just had her premiere of that lecture called Reading the Tea Leaves. It's on the ROCI National website, and I hope we'll have time at our April meeting to have everybody view that together, and we'll invite anyone who would like to come and see that. She did a fabulous job, and just had a little bit of pressure because it's our 100th anniversary, so but she really did a great job with that. And we did submit another nomination for the ROCI Lecture Award for this upcoming year, and that was Dr. Wayne Wirt. So fingers crossed, we'll see how that one comes out. We also, for the second year, nominated one of our alumni for the ROCI National Alumni Honor Roll, and that was Dr. Robert Page, for those of you who may know Robert. And he spoke to the chapter at this month's meeting, right? He was very funny, as always, very good, entertaining. For the second year in a row, our chapter was a finalist for the Most Improved Chapter nationally, and for the first time, they were a finalist for Chapter of the Year. So we have 132 ROCI chapters in the country, and for us to be top 10 in both of those categories, super excited and super proud of everyone for their achievements with that. So if you guys would give them a round of applause for all their efforts with that. I think that's pretty much everything I was going to mention. Did I miss anything big? Okay. So as a token of our appreciation, we are giving each of our officers, Dr. Vanna.
I was worried. About
We're giving each of our executive board members a copy of the RX Prep NAPLEX review book so that they can start getting ready for those boards next year. So we hope you guys will find that a helpful reference to help you get to sleep at night through the next year. And again, really thank all of you for your service this year. Thank you. All right, next I'd like to recognize our committee chairs for their leadership roles in the chapter this year. And please come forward when I call your name. Brittany Houston and Melissa Ferris. Are they here tonight? Yes, there they are. All right, as they come down, I'll give you a little info about them. So as a service to our student body, many of our ROCI members serve as small group and large group supplemental instructors for our students. Brittany served as the small group supplemental instruction coordinator. She worked closely with Dr. O'Neill at the MUSC Center for Academic Excellence to ensure that our students had enough small group supplemental instructors available to help with that extra assistance they may have needed for their more difficult coursework. And then Melissa served as the large group supplemental instructor coordinator. These are kind of pre-test sessions specifically geared toward DPT, our favorite course, to help prepare the students to get ready for those exams. So in addition to our two coordinators, I'd like to call up the ROCI members who served as supplemental instructors this year because they guys take a lot of time and energy to give back, and I want to recognize that. So please come forward when I call your name if you're here. Cassidy Bates, Bethany Burnett, Amanda Everett, Melissa Ferris, Amelia Furbish, Hunter Hanna, Maddie Sudreth, and Michaela Yaskulski. So everyone, please join me in thanking the committee chairs and our supplemental instructors for their service to the college this year. So each of them is going to get a pharmacotherapy handbook. And for those who aren't here today, we will get those resources to them. We're hoping you'll find those helpful as well. I would like to recognize Beth Anderson from Astellas Pharmaceuticals for donating these books for our students this evening. She also provided Sanford Guide All Access mobile, I put devices, that's not right, but the Sanford Guide All Access mobile app to every ROCI student, which is like $100 a piece. So we are very grateful for her support in helping us get resources to our students and help them out with their rotations and things that are coming up. So thank you all again for your service to the college. And then finally, we'd like to recognize our fourth year students who will be graduating in May. I know quite a few of them couldn't be with us tonight, but I'm going to list everyone. And for those of you who are here, please come forward to be recognized and receive your cords. Blakely Adams, Bethany Burnett, Lyric Chaplin, Kaylin Diosis, Patricia Farron. Oh, come on, some of you guys gotta be here. I thought Kaylin was here. Eleni Gaspar, Danielle Greco, Lynn Hazard, Allison Keys, Kathy Lee, Amari Marshall. All right, Emily, I know you're here. Emily Overley, Drew Salk, I know you're here too. Sarah Taylor and Sarah Wyatt. So we're very happy you ladies could be here with us this evening. Congratulations on all your achievements while you've been here as a student. We'll get you guys to put your cords on and get a picture with Dr. Hall. They'll be wearing those cords at graduation not too long from now. Congratulations. As I mentioned earlier, ROCI is celebrating its 100th anniversary. We just had a big celebration in San Antonio, Texas at the APHA annual meeting. We as members are laying the foundation for the next 100 years. Our society encourages us to stay involved as lifetime members by supporting your chapter or serving nationally as a speaker, a mentor, an advisor, or on the executive council. So we hope everyone who's a member will keep that in mind. You are a lifelong member of this group and we want to keep you engaged. So with that, this concludes our initiation and awards program. We invite everyone to join us out in the lobby for dinner and a celebration of our 100 years in ROCI. Congratulations to our new initiates, and thanks again to everyone that helped make the chapter so successful this year. Have a great evening. Oh, hang on one second, guys. There's a couple of people we forgot to. Did you get more cords up? Yes. We have a couple of people that aren't like in the main group that we failed to recognize that are going to be graduating that need to come up here and get their cords. Can you give me the one that you just found? Ahmed Alanazi, come up here and get your cords. Shema, Hazaidi, come get your cords. And we also understand that Kareem Heslop is here as well. He was inducted as a graduate student and will be graduating. So please come up and get your cords. Awesome. Thank you guys so much.
Absolutely, absolutely.
All right, enjoy.